morning, distinguished guests, esteemed partners, and our valued stakeholders. I would like to welcome you to the PSHAN Annual Awards 2025. Here today, we celebrate excellence, innovation, and the impact in Nigeria's health sector. While we await the start of today's program, I would like you to enjoy the lovely music on the background and visuals highlighting PSHAN's remarkable journey and achievements. My name is Chibuikem Chris, and I'm pleased to be your host for this very event. Please enjoy. Ladies and gentlemen, you all are welcome back. And right about now, I hope you all enjoy the visuals because we are about to officially kickstart this very event. And to do that, of course, we have to pay respect to our country. So now it is time for us to take the national anthem. So if you could please stand or sit respectfully as we recite the national anthem. Thank you. Thank you, ladies and gentlemen. And now to kickstart this, I would like you to join me in welcoming the Managing Director and Chief Executive Officer of the Private Sector Health Alliance of Nigeria, Dr. Tinuola Akingbolabe. She takes our opening remarks. Thank you.
Distinguished guests, esteemed colleagues, partners, and friends, good morning and welcome. On behalf of the Private Sector Health Alliance of Nigeria, it is my great honor to warmly welcome you to the 2025 PSHAN Annual Awards taking place virtually this year. Though we may be connecting from different locations, the spirit of celebration that unites us today is stronger than ever. This event is a special moment for us at PSHAN. It's a time when we gather to honor, recognize, and celebrate extraordinary individuals and organizations whose contributions are transforming healthcare in Nigeria. The fact that we're doing this virtually in no way diminishes the weight of the celebration. In fact, it reminds us that our work, our impact, and our commitment to better health for all Nigerians transcends physical boundaries. Today, we shine a spotlight on champions, leaders who have shown courage, organizations that have demonstrated innovation, and partners whose unwavering dedication continues to inspire hope and drive change. Your efforts prove that progress in healthcare is possible when vision meets action and when collaboration is placed at the heart of every initiative. The PSHAN Annual Awards is an occasion of recognition. It's also a moment of gratitude to our nominees and our awards for their leadership, gratitude to our partners and our supporters for their faith and their commitment, and very special gratitude to our board of directors, our esteemed panel of judges, PSHAN alumni, and our team members who have made this possible. We appreciate every individual and institution, near and far, working to ensure that no Nigerian is left behind when it comes to access to quality healthcare. Congratulations to all our nominees and winners. Today is about you. This recognition is a tribute to what you have achieved and the example that you continue to set for others. Your work encourages us all to strive harder, aim higher, and dream bigger for our country, Nigeria. As we move through the ceremony, our hope is that this celebration inspires us all and keeps us building a healthier, stronger, and more inclusive Nigeria. Once again, welcome to the 2025 PSHAN Annual Awards. Thank you for joining us, and we hope you enjoy the show. Thank you.
Thank you very much, Dr. Tinoola. We do appreciate you, of course. And right now, we are going to take the welcome address from our esteemed board chairman, the chief host of this very event, Mr. Jim Ovia, the founder and chairman of Zenith Bank.
My name is Jim Ovia. On behalf of the board of the Private Sector Health Alliance of Nigeria, I warmly congratulate the management of the Alliance on this occasion of the 2025 Annual Awards. Each year, this event reminds us of the power of collective purpose and our shared commitment to transforming Nigeria's health landscape. It is inspiring to see PSHAN continually raise the bar in promoting sustainable private sector management for the National Health Alliance improvement. The annual awards have grown into more than a night of recognition. They have become a celebration of individuals and organizations leading with true impact. This year's theme, Champions of Change, Celebrating Impact, reflects remarkable work happening across the network. It reinforces the importance of celebration, collaboration, and accountability, and each driven partnership. The task ahead requires courage, creativity, and shared vision, qualities PSHAN embody. As we celebrate today's honorees, let us also renew our resolve to sustain this momentum. Congratulations once again on an outstanding and meaningful event.
Thank you very much, Mr. Jim Ovia, founder of Zenith Bank. And right about now, ladies and gentlemen, we are going to take a special address from our distinguished board Director, Mr. Aigboje Aig Mokwede, the Chairman, Access Holdings. Thank you.
Distinguished guests, ladies and gentlemen, it is a pleasure and an honor to join you at this year's PSHAN Annual Awards, a celebration of vision, innovation, and impact in Nigeria's health sector.
We are proud to stand with PSHAN and its partners in this remarkable journey. Today, we celebrate not just achievements, but the power of collaboration to transform lives.
Over the years, PSHAN has shown that when the private sector unites behind a shared vision for health, extraordinary things happen. From revitalizing primary healthcare centers to improving health outcomes across Nigeria, your work is restoring confidence in our nation's health system.
At the Aig Foundation, we believe sustainable change begins when leadership meets compassion. Through our partnership with PSHAN and the Adopt a Healthcare Facility program, we've adopted 23 centers, 18 in Edo State and 5 across other states, bringing affordable, quality care to thousands of families.
These centers are more than buildings. They are a symbol of hope, access, and dignity. And they are proof that innovation, when matched with implementation, can bridge the gap between policy and people.
Every life saved, every mother safely delivered, every child vaccinated tells the story of what partnership can achieve. We commend PSHAN's leadership, its board, and every private and public partner driving this vision forward.
To the 2025 award nominees and winners, congratulations. Your achievements embody the spirit of excellence and the spirit of purpose that drives PSHAN's vision. A country, Nigeria, where every citizen can access quality healthcare regardless of status or location.
Let us continue to build on this momentum with empathy, evidence, and excellence until every Nigerian has the healthcare they deserve.
Together, we are building a legacy of collaboration that will define the future of health in our nation. Thank you, and congratulations once again to all our champions for change.
And now, another special address from another board director from PSHAN. Ladies and gentlemen, join me as I welcome the CEO at Aliko Dangote Foundation, Madam Zuera Yusufu. Thank you.
I congratulate the Private Sector Health Alliance of Nigeria, PSHAN, on the successful execution of the 2025 Annual Awards. The consistent dedication and clear vision demonstrated throughout this event exemplify PSHAN's commitment to advancing sustainable health outcomes through private sector engagement. The theme for this year's award, Champions for Change Celebrating Impact, appropriately acknowledges individuals and organizations whose innovative contributions have advanced health system strengthening efforts. The PSHAN Annual Awards serve as a platform not only for recognizing impact, but also for fostering collaboration, accountability, and evidence-based progress within the healthcare sector. A central component of this progress is the Adopt a Healthcare Facility program, ADHFP. This initiative showcases how strategic innovation and compassionate leadership can drive significant improvements in Nigeria's primary healthcare system, making quality care more accessible to underserved populations. Looking forward, it is essential that this recognition motivates stakeholders to further strengthen partnerships, replicate successful approaches, and sustain forward momentum achieved thus far. Congratulations again to PSHAN for its exemplary leadership, and congratulations to all honorees recognized. Thank you.
Up next, we would like you to learn more about PSHAN, their journey, and the incredible work they do to improve health outcomes in Nigeria. And to do that, please keep your eyes fixed on the screen for the video. Thank you.
Across Nigeria, the pursuit of quality, affordable, and accessible healthcare remains an illusion that we all seek to pursue. In this journey of trying to improve health outcomes, the Private Sector Health Alliance of Nigeria, PSHAN, stands as a unifying bridge to bring innovation, development partners together, the government of Nigeria, and philanthropic organizations to ensure that together we can work to improve the health outcomes across the landscape. Established in 2014 to harness the power of the organized private sector, PSHAN aligns corporate leadership and investments with national health priorities, ensuring that every intervention delivers measurable, lasting impact. Through advocacy, partnerships, and strategic collaboration, PSHAN has become the leading convener for private sector engagement in Nigeria's health system. Over the years, PSHAN has driven several landmark initiatives that have shaped the Nigerian health landscape. The Nigerian Health Quality Initiative, supported by the Bill and Melinda Gates Foundation, improved the quality of care across 130 healthcare facilities, where we recorded over 182,000 safe deliveries and significant reductions in maternal and neonatal mortality. Another project done by PSHAN was the Shaping Equitable Market Access project, where we worked with other partners in the market assessment for family planning commodities to strengthen the reproductive health landscape in Nigeria. With the Healthcare Leadership Academy, we developed a new generation of health leaders equipped to solve Nigeria's most complex health challenges. The Africa Resource Center continues to guide strategic transformation across federal and state ministries of health, while the Health Strategy and Delivery Foundation drives evidence-based decision-making and reforms. From advancing technological innovation through the Nigerian Health Innovation Marketplace to improving nutrition outcomes with the Aliko Dangote Foundation Integrated Nutrition Program, PSHAN stands as a catalyst for sustainable progress. Each partnership, each program is a statement of our belief that when the private sector leads with purpose, national health systems thrive. PSHAN's approach is grounded in evidence and collaboration. By convening public, private, and development actors under one coordinated framework, PSHAN continues to drive health financing reforms, scale digital health innovations, and promote sustainable models that ensure transparency, accountability, and efficiency. Our partnerships with the World Health Organization, the United Nations Population Fund, and other leading Nigerian corporations have enabled system strengthening programs that reach communities where the need is greatest. From strengthening the quality of healthcare to shaping policies, expanding access, and supporting digital innovation, PSHAN continues to be a forerunner for improving healthcare outcomes across the landscape in Nigeria.
Ladies and gentlemen, we hope that you've been enjoying the award so far. Right now, it is time for us to take the keynote speech. And to deliver this keynote address, we are honored to welcome the Special Advisor to the President on Health, Dr. Salma Anas Ibrahim. Over to you.
It is a great honor to be with you all at this year's PSHAN Annual Awards, a very important gathering that celebrates excellence, innovation, and collaboration in Nigeria's health sector development. Though we meet virtually today, the energy of shared purpose and impact connects us powerfully across all regions of our country. The theme, Champions for Change, Celebrating Impact, could not be timely. It is a reflection not only of the achievements we celebrate today, but also, most importantly, the collective resolve to build a resilient, equitable, and sustainable health system for all Nigerians. Distinguished ladies and gentlemen, I want to acknowledge that over the past 2 years, the federal government of Nigeria, under the leadership of His Excellency President Bola Ahmed Tinubu, has advanced several strategic reforms in this direction, including the renewed emphasis on primary healthcare revitalization, health security preparedness and emergency response, the reproductive, maternal, newborn, and child health, including adolescent and elderly health, which is popularly known as the RAMCA, the health sector emergency response coordination, as well as strengthening subnational governance and coordination among several other laudable initiatives that are currently ongoing. These reforms are backed by evidence-based policy shifts, integrating data-driven decision-making, performance monitoring, and accountability frameworks in our health delivery systems. In this context, the Private Sector Health Alliance of Nigeria, PSHAN, continues to play a critical and also catalytic role through initiatives such as Adopt a Healthcare Facility Program, the ADHFP. PSHAN has mobilized corporate resources to upgrade health infrastructure, expand access to essential medicines, and strengthen service delivery at the community level. Beyond infrastructure, we also acknowledge PSHAN's commitment to innovation, health financing, and data transparency. Reflects the private sector's growing role as an indispensable partner towards achieving the universal healthcare coverage, of which we remain committed, ensuring that no one is left behind. Distinguished ladies and gentlemen, I'm very glad to mention that tonight's awardees embody that same spirit. Visionaries have translated ideas into measurable impact, improved health outcomes, and advanced our collective journey toward an equitable and quality healthcare delivery. I am indeed pleased to identify with each and every recipient today. I extend my heartfelt congratulations. Your work reminds us that progress in health is not accidental. It is a product of deliberate effort and intentional partnerships, evidence-informed interventions, and relentless commitments to human well-being. I therefore, on behalf of His Excellency President Bola Ahmed Tinubu, I commend PSHAN for its leadership, sustained commitments, innovation, and dedication to fostering public-private collaboration for better health outcomes. Let us continue to champion change, grounded in science, guided by data, clear evidence for action, and driven by compassion. I want to thank you and to say congratulations once again to all 2025 PSHAN Award winners. Together, we can build a healthier Nigeria for everyone, everywhere. God bless you all. Thank you.
Thank you very much, Dr. Salma Anas Ibrahim. And now we're going to take another keynote address, and this will be taken by Dr. Chikwe Ihekwazu, the Assistant Director General at the World Health Organization, who will share valuable insights on driving sustainability and resilience across Nigeria's healthcare landscape. Thank you.
Distinguished guests, it's an honor to join you for the 2025 PSHAN Annual Awards. Today, we're not only celebrating outstanding individuals and organizations, but also the power of partnerships between government, the private sector, and civil society in shaping the future of public health. This year's theme captures the essence of this. Across Nigeria, we have seen what can be achieved when sectors collaborate around a shared vision of improving health outcomes and strengthening national public health systems. Through the Private Sector Health Alliance of Nigeria, diverse partners have come together around a common goal to support national priorities. PSHAN's role in convening and coordinating this collaboration has demonstrated how innovation and commitment, when aligned with public health goals, can make a lasting difference. Today is also about reaffirming our shared responsibility to go even further. As the global health landscape evolves, Nigeria's path forward must continue to be grounded in continued collaboration, cooperation, local leadership, and a strong commitment to equitable and resilient health systems. To all award recipients, thank you very much. Your work reminds us that collective action across communities and sectors is essential to building a healthier Nigeria for everyone. Let this celebration renew our collective resolve to build sustainable health systems that deliver for every Nigerian in every community at every stage of life. Congratulations too to all our honorees. and to PSHAN for championing collaboration for health and for service. Thank you.
Okay, ladies and gentlemen, trust me, you are going to like what is coming up next. We said here, we're here to celebrate the very important people who have made transformation in the health sector. And right now, we know that that cannot be done without the help of our esteemed judges. And here, we have our judge to share the insights on the selection process and how everything goes in order to celebrate the incredible work for this year's nominees. Over to you.
Good day, distinguished guests, partners, and friends of PSHAN. Over the past 2 years, the PSHAN Awards have celebrated changemakers advancing Nigeria's health sector. This year, the awards took a remarkable leap forward with a more rigorous 3-stage selection process, beginning with the public nomination phase, where the public submitted outstanding individuals and organizations across 5 categories and 25 subcategories. The top 5 in each category advanced to the public voting stage, allowing the public to choose the final 3 nominees per category through open, transparent voting. Finally, in the expert ranking stage, a panel of 5 judges conducted an in-depth review using an automated scoring system. In addition, PSHAN, for the second time, proudly presents the Most Valuable Partner MVP Award, a special honor recognizing an exceptional ecosystem partner. Congratulations to all nominees shaping a healthier, stronger Nigeria.
And now, the first award category, that is the federal, state, and local government MDAs. Now, this category recognizes outstanding leadership, policy innovation, and sustainability efforts within Nigeria's public health institutions. Let's begin. Our first subcategory, Healthcare Equity and Access Award. This award honors state governments expanding equitable access to healthcare, especially for marginalized population. And the nominees are Enugu, Abia, and Taraba. And the winner is Abia. Overhauled 200 PHCs and upgraded referral hospitals under Project Ekweme. The next subcategory, Healthcare Policy Champion Award. We celebrate MDAs whose policies have significantly improved healthcare access, affordability, or quality. And the nominees are National Health Fellow Program, NHFP, Basic Healthcare Provision Fund, BHCPF, National Healthcare Workforce Expansion. And the winner is Basic Healthcare Provision Fund, BHCPF disbursement. Released 32.88 billion naira to strengthen 10,000 plus PHCs. Congratulations to our award winners. We see you, we appreciate you, and we hope that you continue the fantastic work that you have been doing. And the next subcategory is the Maternal Equity Advancement Award. This award acknowledges MDAs and organizations that are improving maternal health through inclusive programming and gender equity. And the nominees are National Health Insurance Authority, NHIA, National Primary Healthcare Development Agency, NPHCDA, Federal Ministry of Health and Social Welfare, FMOH and SW. And the winner is Federal Ministry of Health and Social Welfare, FMOH and SW. Funded 8,800 facilities and rolled out 6 maternal health policies, 2024 to 2028. Congratulations to you. We appreciate your wonderful work that you do. And the next subcategory, ladies and gentlemen, is Sustainability in Healthcare Award. This award celebrates innovative strategies, reducing healthcare's environmental impact while advancing public health. And the nominees are Federal Ministry of Environment, Department of Climate Change and Environment, Rural Electrification Agency, REA, National Agency for Food and Drug Administration and Control, NAFDAC. And the winner is Rural Electrification Agency, REA, installed solar-powered PHCs under the Energy for Health initiative. Congratulations, we appreciate your wonderful work. Thank you. It is time for the second category, which is Media and Innovative Health Communications. Now, this category recognizes the work of media professionals, organizations, and innovators who have advanced public health awareness through storytelling and technology. Now, the first subcategory is Health Journalism Excellence Award. This award honors individual journalists delivering impactful, fact-based healthcare stories. The nominees are Rita Okonobo, Ojoma Akor, Chiemelie Ezeobi. And the winner is Chiemelie Ezeobi. Links health to social equity, system change, and outreach. Congratulations, Chiemelie Ezeobi. We appreciate you. We thank you for the fantastic work that you have been doing. And the second subcategory, ladies and gentlemen, is Media Health Champion Award. Now, this award celebrates media organizations that have used their platforms to drive advocacy and health education. The nominees for these awards are Nigerian Health Watch, Wazobia FM, Channels Television, and the winner is Channels Television. Channels Television uses TV features to educate on maternal health, HIV, and NCDs. Congratulations to Channels Television. We appreciate the fantastic work that you have been doing. Congratulations to our award winners. We thank you for your outstanding service. Speaking of outstanding, the next subcategory, ladies and gentlemen, is the Outstanding Health Investigation Award. Now, this award celebrates powerful investigative journalism that uncovers systemic healthcare issues and drives accountability. And the nominees are Usman Bello Balarabe, Daily Trust, Janet Ogundepo, Punch, Damilola Ayeni, Foundation for Investigative Journalism. And the winner is Damilola Ayeni, Foundation for Investigative Journalism. Investigated a 4-year pregnancy case exposing a crime ring in Eastern Nigeria 2023. Congratulations, Damilola Ayeni. We appreciate your outstanding service. Ladies and gentlemen, we have come to another subcategory, and this happens to be the people's favorite. Yes, because this is the Health Influencer of the Year. This award acknowledges digital creators and community health influencers promoting credible health content and inspiring better health behavior. And the nominees are Nuruddin Shotayo, First Doctor, Dr. Ayodele Rena, the Noisy Naija Pediatrician, Dr. Chinonso Egemba, Aproko Doctor. And the winner is Dr. Ayodele Rena, the Noisy Naija Pediatrician. Thank you so much for your outstanding service. Thank you for influencing Nigerians to live better. We appreciate you. Thank you very much. You have produced humorous, engaging content on child health and prevention. Congratulations once again. Next up, ladies and gentlemen, we would like you to take a moment to witness the inspiring story of transformation, the Adopt a Healthcare Facility Program Impact documentary, showcasing achievements, milestones, and community impact of PSHAN's work. Thank you.
Millions of Nigerian women and children lack access to quality healthcare, resulting in unnecessary suffering and loss. The journey to motherhood is often fraught with risk, and many infants face significant challenges in their early years. The Adopt a Healthcare Facility program, implemented by Private Sector Health Alliance of Nigeria, aims to change this narrative by providing accessible, affordable, and high-quality healthcare services to rural and underserved communities. By strengthening primary healthcare facilities, we can improve health outcomes and build a healthier future for Nigerian women and children. One of such initiatives is the Adopt a Healthcare Facility program, which was launched in 2022 with 2 primary healthcare centers at the start.
We are here today, stakeholders and decision makers in the organized private sector, the public sector, civil service, and indeed across the entire health ecosystem. The ADHFP, Adopt a Healthcare Facility program, is an idea whose time has come.
In the spirit of the Adopt a Healthcare Facility program, therefore become pragmatic models necessary for our vital duty of preserving life.
This initiative aims to rejuvenate primary healthcare facilities, providing communities with the essential healthcare services they need, specifically where it's needed.
25 local governments in our state we are from. So I'm equally adopting 25.
Healthcare is a value chain, and I think people need to understand that you don't have to do everything, but whatever you choose to do, then you must understand why.
Through our What Can We Do Together initiative, the MTN Foundation has supported 49 primary healthcare centers with infrastructural renovations, solar energy, essential medicines, and equipment. This is not just CSR, it's a commitment to saving lives.
I'm a multi-health Oduwa, Director of Community Health, Edo State Primary Health Care Agency. So, I work in Ute PAC in Ekewa. I was posted to this place. When they posted me to this place, I look at it and say, how can I work here compared to where I'm coming from? But suddenly we were just sitting one afternoon, then we see a group of people. That was in the month of November 2023, telling us that they are coming to renovate this place. We thought it will not come to reality. But suddenly, 2024, we saw them telling us they are coming to renovate this place. We thought it was joking. When we came, in less than 1 month, all the renovation was done.
My name na Erica. Ade Ekiwa. Ute. Before, people like me now, for me to come before, I no go like to come. I go like to go another place. But since where they come do and so, I dey come with my own children, with my other neighbor. The place now, who want born, go fit come. Medicine now dey.
Since the inception of ADHFP over 3 years ago, the initiative continues to transform lives and strengthen communities across Nigeria. Behind every statistic is a story, a mother, a child, a family whose life has been touched, treated, and saved. Beyond buildings and structures, our data tells a powerful story of impact. From 2022 till date, over 500,000 individuals have accessed healthcare services across our supported PHCs. 47,000 plus women received antenatal care, over 10,000 safe deliveries conducted by skilled bed attendants, and over 170,000 fully immunized children. Also, we have trained over 100 healthcare workers across our supported PHCs to deliver quality healthcare. The ADHFP continues to drive change, one data point, one life, and one community at a time. Thank you to our doctors and partners for making this possible.
Our vision is clear. One adopted PHC across every local government area. All 774 to serve as working models for the nation. And we're just getting started.
Each of us in this room should adopt a primary healthcare facility. And you don't necessarily have to do it alone.
So I think with this partnership between the public and the private sector, we will definitely achieve by turning around our health facilities. I would like to call on other businesses or other, well-to-do persons in Nigeria to also try and adopt a health facility.
Emeka and Nkechi, I dey very sure say you think say the most important building for your community na church or mosque, make I run go pray. But so those of you wey know they go church or mosque, they even think say na market. No, I dey talk about the place you suppose save your life. Where if your pikin dey run fever right now, you suppose run go. Or that your neighbor wey you no like, wey run inside labor, na there you suppose carry am go. Primary healthcare center. See, primary healthcare center na the foundation of our healthcare. You know, say if you want build house, go first start from foundation. Some of us they build story building on top house wey no get foundation. And I want to inform you, say right now, that foundation don't crumble finish. It don't dey crumble as we dey see am. You go see am, grass don't dey grow. Where people suppose they talk, silence don't dey there. Now imagine say you run go hospital, nurse no dey, doctor no dey, lights no dey, no basic equipment. That one no be hospital again. That one na just broken building. But we know they talk about broken building now. We dey talk about the family where their pikin wey suppose dey alive now don't die because disease wey we suppose prevent don't enter something else. Simple cough don't become something worse. And when the foundation don't weak, the entire future of our country they at great risk. That's why it's important for all of us, especially me and you. Say this revitalization of the primary healthcare centers no be optional. Right now, na matter of life and death. Because every time we abandon primary healthcare center, one pikin wey suppose get the required vaccine no go get them. One preventable disease go start to spread. Before you know wetin dey happen, treatment wey no suppose even cause anything, wey they suppose treat now don't enter wahala. Family wey just start life don't enter gbege because place where they suppose go to get help for simple fever, they don't go where they no suppose go, don't spend so much money. Because me and you no feel let's make them build our future on top foundation where don't they crumble. Now we suppose they act. Because healthier Nigeria, now with healthier community they start to. Or how Oyibo they take talk am. A healthier Nigeria starts with a healthier community.
Ladies and gentlemen, we hope you've been enjoying the awards so far. Right now, it is time for the third category of awards. And now this category happens to be the indigenous NGOs, local healthcare institutions, and community-based organizations. Now, this category celebrates locally founded and led organizations making impact at the grassroots level through innovation and resilience. The first subcategory is Healthcare Partnerships Champion Award. This award recognizes impactful collaborations, improving community health outcomes. And the nominees are Christian Health Association of Nigeria, CHAN, Institute of Human Virology Nigeria, IHVN, T.Y. Danjuma Foundation. And the winner is Institute of Human Virology Nigeria, IHVN. Congratulations, Institute of Human Virology Nigeria. They have expanded HIV, TB, and cancer services across 500 plus health facilities in 20 plus states. Now, that is outstanding service. Congratulations, and we thank you for your amazing contribution to the health sector. And now, the next subcategory, the Community Health Impact Award. Now, this award honors organizations transforming health through community engagement and advocacy. The nominees are Women Friendly Initiative, WFI, Jackin NGO, Saving Women and Children, SWAC Foundation. And the winner is Women Friendly Initiative, WFI. Congratulations to you. Women Friendly Initiative offers SRH and community education to women and youth, trains TBAs and CHWs in FCT, Gombe, and Bauchi. Congratulations for your outstanding service. And next up, ladies and gentlemen, we will be awarding the Disease Control and Prevention category. Now, this celebrates leadership in preventing and managing disease outbreaks. And the nominees are Center for Integrated Health Programs, CIHP, Association for Reproductive and Family Health, ARFH, Society for Family Health, SFH. And the winner is Society for Family Health, SFH. Congratulations to you. Society for Family Health reached millions of children through malaria prevention campaigns. Congratulations once again, and we thank you for your outstanding service. Okay, ladies and gentlemen, I'm sure one time in our life we've all heard the saying, anything can happen at any time. And this is where the next set of people come in. Now we're going to be giving an award for Emergency Response and Resilience Award. Now, this award recognizes rapid and effective emergency responses to health crises or natural disasters. And the nominees are Health Emergency Initiative, HEI, Women Friendly Initiative, WFI, the Blood Drive Network. And the winner is the Blood Drive Network. Congratulations to the Blood Drive Network. The Blood Drive Network mobilized 10,000 plus voluntary blood donors across Nigeria. And I do not need to tell you how important that is. Thank you for your outstanding and amazing work in the health sector. We appreciate you. Congratulations once again. And the next subcategory of award is Capacity Building and Health Workforce Development Award. Now, this award honors organizations investing in training and strengthening Nigeria's health workforce. And the nominees are ABC Health, African Business Coalition for Health, HACEY, HACEY, Biomedical Laboratory Science Innovation Academy, BMLSIA. And the winner is HACEY, HACEY. Congratulations, HACEY. We appreciate your outstanding service. Now, HACEY digitized records in over 100 PHCs and trained over 500 health workers on digital tools. Congratulations to you. We thank you for your outstanding service. Ladies and gentlemen, we have come to another category. This is category 4, and I hope you are excited. Yes, because this category, we will be awarding individuals. Now, this recognizes visionary individuals driving innovation, leadership, and philanthropy across Nigeria's healthcare landscape. The subcategory is the Healthcare Leadership Award, and the nominees are Dr. Hadiza Shehu Galadanji, Professor Christiana Mojisola Adeye, Felix Ofungu, and the winner is Dr. Hadiza Shehu Galadanji. Congratulations to you, Dr. Hadiza. Dr. Hadiza has cut severe maternal complications by approximately 60% with a postpartum hemorrhage prevention package. Now, trust me when I say approximately 60% is a huge number. So congratulations to you once again, Dr. Hadiza Shehu Galadanji. We thank you. We appreciate you. And now we move to the Outstanding Medical Practitioner Award. The nominees are Professor Folashade T. Ogunshola, Dr. Oluwaseun Shodipo, Dr. Zainab Shenkafi Bagudu. And the winner is Dr. Zainab Shenkafi Bagudu. Congratulations, Dr. Zainab. We appreciate your fantastic work. Thank you so much. Dr. Zainab has screened and treated 40,000 plus women for cervical cancer and expanded HPV vaccination. Now, that is a fantastic number right there. Thank you once again. And now, we move right into the Medical Practitioner Hall of Fame Award. The nominees are Professor Kingsley Ekweme, Dr. Benjamin Anyao, Dr. Ali Pate, and the winner is Dr. Benjamin Anyao. Congratulations, Dr. Benjamin Ayawo, who founded Nigeria's first stroke center, enabling rapid diagnosis and treatment. Now, this is a very big feat. Thank you very much, and congratulations once again. And now, we move right into Health Innovation and Change Agent Award. The nominees are Dr. Olamide Ola Brown, Temi Giwa Tubosun, Sami Ogunjimi, and the winner is Sami Ogunjimi. Congratulations, Sami Ogunjimi, who opened a factory producing over 147 million rapid test kits annually for HIV, malaria, and hepatitis. Trust me when I say this is no small feat. Congratulations to you once again. The next award, ladies and gentlemen, is the Community Health Champion of the Year. And the nominees are Dr. Natasha C. Oyibo, Ambassador Dr. Joy Audu, Rhoda Robinson, and the winner is Ambassador Dr. Joy Audu. Congratulations, Ambassador Dr. Joy Audu, who led outreaches with over 100 surgeries and preventive health education in rural areas. Thank you very much for reaching those areas at a very important. Thank you very much once again, Ambassador Dr. Joy Audu. We appreciate you. Next up, ladies and gentlemen, we are moving straight into Award for Outstanding Philanthropy. And the nominees are Folorunsho Alakija, T.Y. Danjuma, Dr. Suleiman Adebola Adegunwa, and the winner is T.Y. Danjuma. Congratulations to T.Y. Danjuma, who donated $2.26 million with WHO to strengthen healthcare for women and children in 3 states. Congratulations once again, and we appreciate your wonderful work. Congratulations once again to our award winners. And now we would like to take a moment to hear special remarks from a couple of our partners and friends of PSHAN, whose continued support and collaboration makes milestones like this possible. Over to you, sir.
Hello, everybody. My name is Nonso Akbala. This is a goodwill message from VFD Group. We're particularly impressed with what PSHAN has done over the years. Congratulations to the board of PSHAN and to the founders that have done such a fantastic work. In VFD Group, we think that collaboration is the way forward. Government can't do everything that we expect them to do. The resources are limited. And as a result, individuals, corporate establishments should come together to support the effort of humanity, be it in healthcare, be it in education, be it in every other developmental facet of our life. I think what they've done is fantastic. I want to congratulate them. So big congratulations to those that have been nominated and ultimately those that would win. I think you need to view this as your first step towards more efforts towards supporting humanity. And I wish you the very best in that process. Thank you very much.
Thank you very much, sir. And now we would like to hear from the prestigious CEO of KPMG West Africa, Mr. Tola Adeyemi, whose support to the PSHAN course has been invaluable thus far. Over to you.
Distinguished guests, colleagues, and friends, it's an honor to speak to people who are not just talking about change, but driving it. People who believe, as I do, that healthcare can and must work for everyone, no matter where they live, who they are, or what they earn. As we celebrate our champions for change, I want to speak about 3 things that are absolutely vital to make that vision real: collaboration and leadership, innovation and partnerships, and then private sector and multi-stakeholder engagement. First, collaboration and leadership. If the last few years have shown us anything, it's that no health system is an island. Whether we're facing pandemics, economic shocks, or the growing impact of climate change, resilience is built together. You see, leadership today isn't about commanding from the top. It's about connecting across boundaries and breaking down silos. It's about bringing ministries, hospitals, entrepreneurs, researchers, and communities into the same conversation. True leadership inspires collaboration, and collaboration is what increases impact. By creating systems that can adapt, recover, and thrive, even in the face of uncertainty. Second, let's talk about innovation and partnerships. When we talk about innovation, we often think of technology, but innovation is also about mindset, about daring to do things differently. It's about using data to reach the unreached, designing financial models that make essential medicines affordable, creating energy solutions that keep rural clinics open when the national grid fails. And none of this happens in isolation. Innovation flourishes where partnerships exist. When governments create the right policies, when businesses invest responsibly, when civil society holds us accountable, and when we all keep people, not profit, at the center of progress. Third, private sector and multi-stakeholder engagement. Now let's be clear. Achieving universal health coverage will take all hands on deck. The private sector has a powerful role to play, not just as a funder, but as a problem solver, an innovator, and a partner. From supply chains to data systems, from pharmaceuticals to infrastructure, the private sector can help close the gaps that keep too many people from accessing care. But this only works when partnerships are built on trust, transparency, and shared purpose, where everyone brings their strengths to the table and no one is left behind. In closing, I make a call to action because we all know change doesn't happen by accident. It happens when people like you and me make a conscious decision to stay committed, to keep collaborating, and to keep pushing for better. So I urge each of us today to also rise up and be champions of change. Let's lead boldly. Let's invest in innovation that saves lives. Let's deepen partnerships that deliver results. And let's hold ourselves accountable for the promise of universal health coverage, not as a slogan, but as a lived reality for every person. Together, we can build healthcare systems that are not only resilient, but truly transformative. Systems that withstand crises, serve communities, and secure the future of health for generations to come. The time to act is now. The responsibility is ours, and the opportunity is extraordinary. Thank you very much.
And now, ladies and gentlemen, we have come to the final category for today. I'm sure some of you are excited already because this category is the organized private sector. Now, this final category celebrates private sector actors, corporations, startups, and coalitions driving innovation, investment, and sustainability in healthcare. Now, the first subcategory is the Healthcare Innovation Award, and the nominees are Doctora eHealth, AfriHealth, Drugstock, and the winner is Drugstock. Congratulations to Drugstock, who delivers same-day medical supplies through its digital platform, cutting out counterfeit drugs. Now, I do not need to tell you how important it is to get the authentic thing in healthcare. So congratulations to you, Drugstock, and we appreciate this fantastic service. Next up, ladies and gentlemen, we have the Healthcare Social Responsibility Award. And the nominees are Total Energies, Fidelity Bank, and Korea Asset Management. And the winner is Fidelity Bank. Congratulations to Fidelity Bank, who donated maternity kits, renovated PHCs, and supported hospices for children with special needs. Congratulations to you once again, and we appreciate your outstanding work. The next category, ladies and gentlemen, is Health Partnership of the Year Award. Now, the nominees for this award are Seplat Energy, Access Bank, African Development Bank, and the winner is African Development Bank. Congratulations to African Development Bank, who invested $46 million in Sokoto to build climate-smart health infrastructure. Congratulations and thank you once again. Next up, ladies and gentlemen, is the Outstanding Health Initiative Award. The nominees are Ankoria Asset Management, Unilever Nigeria, MTN, and the winner is Ankoria Asset Management. Congratulations to Ankoria Asset Management, who ran cancer awareness for over 100,000 people and screened over 500 people for cervical and prostate cancer. Thank you very much. We appreciate you and congratulations once again. Next up, ladies and gentlemen, we will be taking the Private Sector Health Champion Award. And the nominees are Nestle Nigeria, ICO Insurance, Zenith Bank, and the winner is Zenith Bank. Congratulations to Zenith Bank, who invested 4 billion naira, over 4 billion naira in hospitals, free diagnostics, and community health centers. Now, this is an amazing feat. We thank you and congratulations once again. And now, we move straight into the Digital Health Transformation Award. And the nominees are Health Tracker, DRO Health, Life Bank, and the winner is Life Bank. Congratulations to Life Bank, who delivers blood, oxygen, and medical supplies through its digital platform. Now, this is a very, very important one. So Life Bank, we thank you and we appreciate you. Congratulations once again. Up next, ladies and gentlemen, we are moving into a very, very special award. Now, this award is the PSHAN MVP Award. And this award recognizes PSHAN's most vital partner for 2025. And the winner is World Health Organization, WHO Nigeria. Congratulations to our PSHAN MVP for 2025. We appreciate you and you are very, very special to us. Congratulations and thank you once again. Ladies and gentlemen, we hope you've enjoyed the PSHAN 2025 award ceremony thus far because we are coming to the very end. And we are going to take the closing remark right about now. And to do that, we'd like to call on a phenomenal man who is the head of memberships and partnerships at PSHAN. He goes by the name Mr. Muyiwa Olowoporoko. Thank you.
At this point, we say thank you. Thank you to the esteemed board of directors of the Private Sector Health Alliance of Nigeria, who gave birth to this great dream, and to leadership who have continued to sustain it. Thank you to all our partners in the public and private sector who believed in our vision and continue to work with us over the years. To our sponsors, thank you. We thank you for believing in the dream and vision of PSHAN. Today, we celebrate not just the winners who are going on with the plaques, we celebrate the nominees. That you did not take home the plaque today does not make you less a winner, because indeed you are all heroes of healthcare in Nigeria. The clarion call has come out. Let us invest in healthcare. We call on all private sector and Nigerians of good conscience to please look in this direction and let us together build the healthcare system that we'll be proud of. We are still far away from achieving the SDGs, particularly speaking to health. We need you. We need more adopters to adopt primary health care centers through our ADHFP programs. We can never do enough. The government can never do enough. We are calling on you to say, join us. And while we're looking forward to a great 2026, thank you for how far you have worked with us in 2025. We are wishing you a Merry Christmas and a prosperous 2026. We will do more next year, and we are counting on your support. But until then, bye-bye, and thank you.
Thank you very much, Mr. Muyiwa Olowoporoko, for that fantastic closing remark. We hope you have enjoyed it, ladies and gentlemen. We hope you've enjoyed the annual awards for the year 2025. Right about now, as we conclude the PSHAN Annual Awards, we would like you to enjoy classical violin performance and an elegant finale to a day dedicated to celebrate excellence, collaboration, and impact. My name is Chibuikem Chris, and I'm pleased to have been your host for today. Please enjoy the music, as I hope to see you again next year.